TENS therapy. It is an abbreviation of transcutaneous electrical nerve stimulation. A TENS machine is a small, battery-operated device that has leads connected to sticky pads called electrodes. Your body uses low electrical currents to send messages to different parts of the body, such as brain, nerves, heart, and muscles. The electrical impulses can reduce the pain signals going to the spinal cord and brain, which may help relieve pain and relax muscles, increase blood circulation to targeted areas, and stimulates your body's natural painkillers. What TENS is used for. TENS may be able to help reduce pain and muscle spasms caused by a wide range of conditions including arthritis, period pain, pelvic pain caused by endometriosis, neck pain, knee pain, back pain, and sports injuries. It's also sometimes used as a method of pain relief during labor. How to use TENS. First, try starting with the lowest settings, then increase them to an effective setting. Second, make sure the machine is switched off before you attach the pads to your skin. Place the electrodes at least an inch apart. This will prevent you from having too much electricity delivered to too small an area. Never place the pads over the front or sides of your neck, your temples, your mouth or eyes, your chest and upper back at the same time. Irritated, infected or broken skin, varicose veins and numb areas. Third, adjust the amount of electricity slowly, gradually, and carefully. Finally, make sure the pads have sufficient gel or water on them. Thanks for watching. Don't forget to subscribe.